Hi, Michelle. My name is Jim Durbin. I'm a small business owner in Chesterfield, and I've actually read the entire House version of the bill. One of the reasons we complain when McCaskill tweets that they're reading all the time, I called into their offices during the stimulus, and I had a guy laugh when I asked him if he'd read the stimulus bill. He goes, "It's 600 pages long." Like, that was a crazy thing. So we know a lot of times they don't read, but I read through it, and when I looked through, and there's 7 pages of notes I'm not going to get into, but the big thing for me is I look at this is designed to destroy the private healthcare industry. It's to get rid of all this stuff. Instead that we're supposed to have our own that we're going to keep our own healthcare, but I'm a small business owner. I pay for my own plan. When I first started, I purchased a plan that was $300 a month. And we took it with Blue Cross Blue Shield, we took it to the doctor. It was based on the Medicare plan, which means the doctor only had 7 minutes to spend with my wife when she was pregnant. So we bought the gold-plated one, which was far more expensive. That $300 a month is just about 8% of the average wage of people. And this is what bothers me, is I know what that government healthcare is like, and I didn't want it for my child. We had a premium in the NICU, and I'm just thankful that we had time to catch it and take care of those issues. I could buy a Beamer with what I pay for in healthcare. I choose to because it's important to me. I never would go back to that $300 insurance. And that 8% matters because when I look at what happens, you say you can keep your insurance, I'll be able to keep mine, but I can't change it. And one of the biggest things I have is be able to go to an insurance agent and say, who's got the best premiums? Who's got the best benefits? Under the plan in the healthcare exchange, the premiums are regulated, so I can't really go lower because they're all going to be the same. The benefits are regulated. So the 2 major things I have to keep costs down for my company, the government doesn't allow. So I can keep my plan, but if the costs skyrocket, it's not really the same plan. So it's not really keeping choice, and after 5 years, the plan doesn't count anymore. So we're not keeping our insurance. It's designed to stand our insurance. It's going to cost you 8% as a tax. Basically, taking the 8% that's in the bill. The problem is if you're not paying it now, the only way, let me tell you, small business owners are almost out of business. If it weren't for 2% loans from B of A and Wells Fargo, the ones that are left, and gas that's not $5, half of them would fail. I talk to them every day. We know this. It's hard to run a business, and the idea that you're going to give us 8% payroll tax even, we're going to lay off 1 in 12 workers for small businesses because there's no other way to stay in business. So if they pass this and they have 8% of small businesses, you can count on 1 in 12 people being laid off. There's just no room to cut. And then the final part of it is, lots of friends, my family, other people run small businesses. They pay up to 15% right now for their health care because it matters to them, and they want to take care of their employees. If they're forced with dealing with the healthcare exchange and dealing with all the problems that comes with purchasing it, the easy thing to do is to dump all their employees off on a public option and pay 8%. So what happens is this is designed to drive everybody to that public percent, but it's just like the big box stores, right? They come in, they have really low prices, everybody loves it, all the mom and pop stores are driven out of business, and then what happens? You keep raising the prices. So it may be 8% today, it'll be 15% in a few years, and we'll end up on single payer. I look at this and it clearly is designed to drive us to a single payer. There's no, either they've never run business before, which is true for most of them, or the plan is to drive us to single payer. And that's what bothers me. This plan is designed to crush the private industry and move us all into socialized healthcare. If they just said, we got a guy in the White House who said, I won. That's great. If he came out with Speaker Pelosi and Harry Reid and said, you know what, we won, we're going to have socialized health care, we're going to vote on it because that's what the voters wanted, you know what? They can try to pass it. But they're not. They're saying we're going to cut costs, we're going to make health care better, we're going to insure the uninsured, we're going to bend the cost curve, it's also going to cut the deficit. Come on. This plan is not designed to help. It's designed to drive total health control over the government. That's the goal.
Thank you for sharing, Jen. Thank you for
Missouri. Today I have my twins with me, and my babies were born at 26 weeks, and they're $1 million right there. And fortunately, we had wonderful coverage through our private health insurance company, which I feel saved my children's lives. I remember calling them on the phone and I said, how much will you cover? And they said, whatever is medically necessary, we will do for your children. From the time I was 7 weeks along, I went to the doctor every week and we racked up, incredible costs, and we saw specialists and things. And my children were given a 30% chance of even living, much less they were told they would have disabilities and things like that. My concern is in a society that doesn't value life, such as children like mine. How much will the government pay? Do they pay $1 million for 2 little lives? Or will they say, you know what, this is too much? My doctor also thought that I could be admitted to the hospital as a point of viability, because every other doctor in his office said you've got to wait till 28 weeks because after that point your mental impairment is gone. My babies were born at 26 and they are here because of my wonderful insurance company that I will have to keep.
Hi, my name is Noel. I'm from St. Louis, Missouri. I'm broken foot balance, deaf, and can't hear, and I have a cochlear implant which helped me hear. And I'm into my second year of college this semester. Now, if I didn't have my cochlear implant, I wouldn't be able to hear anything except maybe a jet engine, of course. So, with my cochlear implant, I can talk on the cell phone, I can talk to my friends, like warm conversation, and I can hear music and all those stuff. If I didn't have it, I'm going to be able to do all those things, which is wonderful. Now, the cochlear implant that I have is really inexpensive because it currently costs $50,000 to $60,000 per year. So it's really expensive. Now, after this surgery, it's important to receive the correct education afterwards for the child and learn how to talk. It's expensive to educate a child as hearing impaired. Now, it's also expensive to provide services for those children who's deaf and not well. Now, there are interpreters that are needed to provide services for these deaf kids so they can be able to communicate with hearing people, like if you have an interpreter and talk to you. So I really have that to be able to communicate with you guys. Now, when my mother told me about the health care bills being considered by the House and Senate. Now, they impact the disabled people. I wanted you to know how that would impact me, how difficult it would be to succeed in life without the service I had received. Now, in 6-year-old Emmanuel, Mom Emmanuel's brother, who was involved in the wording of the House bill, said medical care should be reserved for the non-disabled, not given to those who are prevented from being or becoming participating citizens. Now, does that include me if medical decisions are being made by the government, not by my doctors, my parents, or me? I would be determined to be too expensive to receive the services I need to be able to navigate my way into the wall. Now, this is a bad plan for those with special needs. Now, I need to tell Senator McCaskill to vote no.